Thank you, David. That was very speedy. So we will try and get back on some semblance of time here. I have just 3 slides to share out of this whole talk, so we'll be really speedy. I'm a physical therapist. I have been frustrated with my profession for the last few years because I continue to see cases where a diagnosis is treated very well, but the patient is not assessed or treated. And I came upon an article, and we're going to skip over all of these guys here, talking about over-specialization and siloed care. My first career, I was a firefighter EMT. And on the left-hand side here, you can see what the training is like. And oftentimes that is how we research our patients. We have very specified inputs and very specified outputs. Apply intervention A, look for outcome B. That's it. It's very sterile. Our patients are not that. Our patients are complex. Our patients aren't just a diagnosis. Our patient is multifactorial. And in the real world, you train on the left side, and what happens on the right side? You're off in the bushes, you've got a car seat in the back with a screaming infant, the car is on fire, there's lorries going by on the highway. It's not a sterile environment in the real world. And my concern is specialists are good. I myself am a specialist. We're all specialists. We need specialists. But when we isolate ourselves from everyone else because we're too good or our patients are too important, then oftentimes things get missed. Have you seen this before?
Yeah.
This is kind of how we end up practicing because we love our special information, right? This one right here. So this article by Langvin in 2022, we love this horizontal line, right? Either the patient is ill or they're not. Their A1C scores are good or they're bad. The patient either falls or they don't. The patient is independent or they need a higher level of care. But our patients also live on this vertical line, and that is harder to assess, and it's harder to research, and it requires increased time and effort for us to explore those opportunities to reach where the patient is. And that leads me to a little video that I want to share with you about where I have been practicing for the past 3 years. That is really good. So I come with a very much American perspective, and I look forward to these international conferences so that we can connect and we can talk and we can compare. In my world, when a patient comes in to see the provider and the primary care, there are a certain number of priorities that the doctor has to think about, and there's limited time. And we need to talk about all of the things that are important from the medical perspective. And the medical perspective may include things like diagnoses and medication management and mobility and things like that. However, those perspectives may not match the patient's perspective. The patient may have other stressors like his health and his sleep. You mentioned a mortgage payment, right? Family stressors, things going on in their lives. There was a research study that said the average patient into primary care has 6 diagnoses, but the provider only has 14 minutes with them. So how do we prioritize care? I'm proposing a model, and this is where I have been working, where all of the providers are together in the same hallway in the same clinic. So the primary care provider is in there with the social worker, and the social worker can deal with the at-home issues while the primary care provider is taking care of the medical issues. Physical therapy is right there in the exact same hallway with the social worker and the pharmacologist and the mental health provider. We are all in the same hallway together, so that if the nurse sees an issue, the nurse can refer to any of the providers. If the doctor sees an issue, the doctor can refer to any of the providers. If the physical therapist sees an issue and the patient is depressed, there's a social worker, literally a mental health provider across the hall from me. And considering an environment where all of your providers and all of your specialists are not siloed in different hallways or different departments or different buildings or even different parts of the city, but where you can bring providers together to provide a more holistic care for the patients when they come in. So while experts are good, there is the caution of being siloed away from patient access. And these patient aligned care teams where we are all together to focus on the patient's needs may be a good option to consider. I am here tomorrow. I am here Wednesday. I encourage questions. I encourage feedback. And we are on to our next provider.